Got it.
Yeah, and there's so much more. And I think a lot of people don't realize that they haven't hit optimal function. The dog's kind of placing weight and they're getting around and it seems to be done and dusted and they've paid the bill and that's it. And you're like, no. So hopefully we're going to inspire people that when you dive into the world of orthopedic surgery, specifically focused around OA management or prevention or salvage, it doesn't stop when the knife stops. There is still more that needs to be done. So I think
you got it.
First of all, what we need to do is have like an introduction to what do we mean by rehabilitation. So take it away.
Yeah. So I think when we talk about rehabilitation, we can really talk about kind of two avenues. There's what I consider to be more of the owner-driven rehabilitation. So these are exercises and things that I'm having the owner do at home on a daily basis. And then there's also a formalized rehabilitation or physiotherapy plan where we're actually working with the physiotherapist on a weekly or twice weekly basis. And really what they're doing is taking the time period of which your pet is after surgery and doing things to help facilitate healing, but at the same time helping kind of encourage that healing process along. So that way we minimize setbacks and can not necessarily speed up the recovery, but ultimately result in a better overall recovery. So when we get ready to that point to say, okay, let's get back to having fun, the muscles and the tissues are conditioned for that. So we minimize soft tissue strains or setbacks or muscle pulls or things like that.
Yeah. And I think very briefly, because we're going to talk about it in greater depth in a minute, give the prime really in your face, just too obvious example of poor post-surgery response to say an FHO. You know, that person's had the surgery, they've chopped the ball off, they've gone home, jobs are done. And so let me explain, guys, if you've got hip osteoarthritis and it's got to end stage disease and there really is no movement without pain, is it better to actually remove the ball from the socket and have what's called a pseudoarthrosis, so you don't actually have any articulation? And that's a reasonably common surgery. It's done in first opinion practice. It's definitely within a first opinion practitioner's skill base. What can go wrong if you don't have a little bit of a rehab? Very briefly, because we're going to talk about it later.
Yeah, the leg will not work well. You lose hip extension, which is paramount, and it ultimately results in a life of actual discomfort. So, the goal was to remove the ball and socket to resolve discomfort. But if we don't do the things right after surgery, then we can actually result in pain. And so if our goal is to resolve or remove pain, now we've created a condition to have pain. And so we haven't really helped anything. No. And an FHO is the best example when we talk about the need for rehabilitation and management after surgery to result in optimal outcome. So that's a key one. I see time and time again, these guys, they have this surgery, they come in several weeks later and their leg's cocked up, and you try to move it and they turn around and try to bite you. And we're way behind the 8 ball at that point in time.
Yeah, I can remember when I very, very first heard of you, and I listened to one of your podcasts, and that was one of the topics was FHO. So people can kind of understand where rehabilitation fits in. Can we talk to them about, say, the pathophysiology of OA? So what is happening as osteoarthritis progresses? But then look at it locally and look at it globally around the whole body, so people can understand why these rehabilitation plans aren't just focused on the area of surgery as well. So this is what you're amazing at. I'm just going to let you free run it. Talk about OA.
Yeah, that's actually a really great comment you bring up, because realistically, any problem in and around a joint has the potential to result in arthritic changes. And I think most of your followers are probably going to agree with the statement I'm about to make. But OA in the dog is not an old dog disease. It's an any age dog disease because it's almost always exclusively secondary